are live everywhere on YouTube, Instagram, and TikTok. All three of them. Okay, we have crazy filters going on. Let's get rid of that one. Okay, welcome everyone to Tuesday Live. You know I like to come on here at least once a week and check in with everybody. How are you guys doing? Happy Valentine's Day. Oh my goodness. Spent the morning celebrating it. Everyone got a present, including the dog. It was a ton of fun. Do you guys celebrate Valentine's Day? I don't know if it's celebrated around the world. I did read, this is just a random tidbit, I did read that in India, they were trying to make it Cow Hug Day instead of Valentine's Day to kind of bring more of the local culture in. And no surprise, it was a total and complete flop. So anyhow, hope you guys are having a great Valentine's Day. I don't know if you have plans for later today or not, but Valentine's Day is just not about your sweetheart. It's also about family, friends, girlfriends. Happy Valentine's Day as well. And really anyone that you are showing and expressing love to. I think it's great. Some people think it's a commercial holiday and we don't need to place any emphasis on it. But hey, I think anything that makes us stop and pause and appreciate what's right there in front of us is always worth celebrating. All right, let's talk about maybe some of the news of the week and definitely take your questions. Please feel free to post your questions as we're sitting here over the next 20 minutes or so. I'm happy to tackle just about anything. We've been very hormone focused for lots of different reasons. It seems to be really the root of why so many people are not in their best health, why they don't have energy, they're having mood shifts, weight gain, and so much more. Now, of course, anytime we take one topic, there are a lot of subheadings to that topic, right? There's so many different things we could talk about, but here's what's really on my mind lately, our livers. And I can get into this topic in so many different ways, but I realized I was reading a couple of articles over the weekend, and the reason liver health has become such an important issue for me. First of all, Chinese medicine never ignored it. Chinese and Ayurvedic medicine talked a lot about the liver, how important it was to have good liver health, how you could read your face and your tongue and even look at your pulse to understand what was going on with the liver. And if your liver was sluggish, it was one of the first signs that you might not have healthy hormone balance. So the liver was a really important place to begin in the conversation around overall health. Now, in Western medicine, right, in conventional Western medicine, we don't really put that much emphasis on the liver. We check liver enzymes, that's an ALT and an AST, but we really don't dig deep in terms of what does liver function really look like. We're only worried about it when the liver is crashing and burning, which oftentimes is kind of late in the game. So I really want everyone to think about the liver a little bit earlier and how you can recognize signs and symptoms that you have a sluggish liver. Let's start there first. So if you're studying your face, taking a look at the face, if you got a lot of purple right here under the eyes, sometimes that's a sign that you have a very sluggish liver. Now, when you're looking at your skin, if you've got a lot of this like little red, I call them little pinpoint petechiae, they're little red dots kind of all over your skin, sometimes right here on your abdomen as well, again, a sign you may have a sluggish liver. Look at your complexion. Has it gotten a little bit more sallow or pale looking? A lot of times the liver's not doing what it needs to do. And I'll give you one more. If you're getting more belly fat for the first time, really noticing a lot around the abdomen, yet another sign that your liver isn't functioning well. So we've got all these soft signs and symptoms of liver issues, but when it comes to lab work, we're only checking an ALT or an AST, which is often not abnormal unless you have a disease. So you can look at other factors as well. If your cholesterol is too low or too high, there's something called an SHBG that you can check in blood work that also helps you understand kind of where you are with liver health as well. All of these are additional ways to understand what's going on with your liver. Now, why am I so fixated on the liver? Why did I pick this particular topic? Well, open up any news feed you pick, CNN, BBC, it doesn't matter. And there is always an article in there lately about climate change, your toxic load, some toxin being linked to some cancer or some disease of some kind. Am I right? I know you guys have seen this if you're following a lot of this stuff. And it just always gives me a moment to pause. Let me put the pieces together. An article that I can post later talked about the Great Dustbin in Salt Lake, right? So the Great Salt Lake is drying up essentially, and what's left in its place is this great dust cloud. And in that dust cloud is all this particulate matter that's actually damaging our liver. It's toxic. At the same time, the professional ski world, people that have been world champion skiers, they've won Olympics, have gotten together because the snow is melting and they don't have snow to ski with anymore. They are seeing firsthand the effects of climate change. And as climate change is changing our living conditions, it becomes more evident that changes in temperature, as the planet heats up, these changes in temperature in turn increase our toxic load. Toxins are increasing in our air, in our water, in our food, in our soil, and so much more. So all of that directly impacts us. It impacts human health. It impacts our livers. It's why we're seeing more cancer, more autoimmune disease, more issues with infertility, more issues with mental health, because all of it is connected back to the liver. I posted yesterday about that connection. I'm going to try to continue to dive into it and dial into it a little bit, and maybe you guys have some thoughts about it as well. But just follow this logic for a second. It's on the feed for those of you on Instagram. You can check out the carousel. But when your liver gets sluggish, one of the big responsibilities of the liver is to produce bile. And that production of bile is really what helps us to digest well. It's what helps to package up hormones and send them off to where they need to go to do the work they're supposed to do. Now, you've got a liver that's inundated with alcohol, with stress, which Chinese medicine really did believe that stress would live in the liver. So you've got alcohol, maybe stress, maybe you're not eating the cleanest, so you're eating a lot of packaged and processed foods, or you're simply drinking water that's not healthy, breathing air in an environment that is also equally unhealthy. Your toxic load has just gone up. Your ALT and AST are still normal. They're still okay. But slowly, all these other markers are starting to fall. There's more inflammation. There's less and less sort of good gut health, so your microbiome is shifting. Cholesterol numbers are slowly climbing. Insulin markers are slowly climbing as well. And as all of this is happening, it's creating the foundation and the hotbed for disease, which none of us want, right? So then everyone ends up in my office, in the doctor's office, wondering why they don't feel good, they're seeing a change in their numbers, their hormones are where they are, they're gaining weight, and so much more. Now, we've had sessions where we've talked on this live about Ozempic and Wegovy and weight loss and so much more, but none of those conversations dial us back to the central concept around our liver health, our hormone health, and how it impacts blood sugar and even more. What we're finding in research is that when the liver does not work well, insulin or blood sugar levels are higher. What does that mean for you? You store belly fat, lots of belly fat that gets really stubborn and is difficult to move. One of my biggest concerns, honestly, is in our kids. How many of you guys have kids? And you can maybe make a comment below. Where in children, this is showing up a little bit differently. This is actually showing up in their mental health and their cognitive health. What we're finding is that children can't handle this toxic load. They can't handle the environmental burden of chemicals. So they're coming up or presenting with things like sensory processing issues, light and sound and taste and texture, and all these other things become such a big issue for them. They're presenting with issues like ADD and ADHD, anxiety and depression at a really young age. And in turn, they're dealing with conditions we've never seen before that are presenting as mental health issues, but they're actually autoimmune inflammatory issues. It's really bothering me, it's really troubling me, because last week, for example, I had 5 different cases, 5 of them, of kids all the way from 3 to 18 having issues with mental health, normal, well-functioning kids prior, right? The older ones were stars, doing well academically, doing well in every other aspect of life, and all of a sudden, boom, something tripped. And that trip in turn led to this issue with focus, concentration, depression, anxiety, and then progress to more of an oppositional, defiant behavior where they're openly refusing to go to school, they're raging, they're dangerous to themselves and to others, and it's becoming a nightmare for families. Well, my platform, as many of you guys know, is about the whole family. It's about how the whole family comes together. And this issue of liver health is impacting every single family member in different ways. For the women, we're seeing it as hormone imbalance, and we're seeing it as issues with fertility, focus, concentration, weight gain, and more. For the men, it's the plummeting levels of testosterone, where testosterone levels are getting lower and lower than they've been in previous generations. Even with men in their 20s, sorry, tripping over my words there, but men in their 20s are having issues with testosterone nowadays, which was not so much of an issue just 50 years ago. So men are seeing it with their hormones as well. They're seeing it with their weight, and they're seeing it with their mental health too. And our kids are seeing it as sensory processing disorder, cognitive delay, ADHD, rage, ODD, all this other stuff. Back to climate change. If we don't address climate change on one hand, but the health implications of that on the other hand, and change the model of medicine we're practicing in our exam rooms, then we're not going to be healthy. So here's where medicine needs to shift. We've got to be thinking, screening, and talking about the liver. What's your liver health look like? Do you have the genetics for a weaker liver? Do you have things like MTHFR or SOD or COMT? It sounds like alphabet soup. Then knowing this information is helpful on the front end to prevent someone like you from really developing a disease down the road. It's no longer where we can come in and just kind of check the boxes, because as the environment changes, the diseases, as we've seen, really change as well. And we've got to be prepared for that. So your liver health matters, and understanding what's going on with the liver is so critical to overall health now, and so critical to really balancing and managing the load of toxins we're all exposed to now. So whether it's the Alps or the Great Salt Lake or anywhere else on the globe at the moment, the sort of intersection between climate change, health, human health, toxic load, liver health, it's all there. And we have to be open and honest that we're willing to deal with it. This is why, again, we've got to be careful about the type of hormone you might go on. Heavy-handed doses of hormones hurt the liver. We've got to be conscious of how much medication you're on. I don't believe medicine's good or bad, but too much is a problem. And we've got to be aware of the food we're eating, where it's coming from, and the quality of it. Otherwise, we in turn are impacting our very own health. All right, that's my soapbox. Let's see if you guys have any questions. We can take questions on anything, but this issue of liver health and what it's doing to the body is obviously bothering me, and definitely want to dig into it further in the weeks ahead and months ahead, but more so hoping that we treat it differently in our exam rooms. Okay, let's see. Do we have questions, guys? We can take questions. And by the way, we're live on all platforms. We're on TikTok, we're on YouTube, and we're on Instagram. If you guys have questions, please feel free to put them in the comments below. Happy to take any of them, and want to remind you guys about my Superwoman Circle. We meet monthly for group coaching, and we do a webinar once a month as well. And all of that is a way for the community to connect, ask questions, and really improve your own personal health, but more importantly, the health of the family. My goal with the circle is really that you'll take the information that you learn and you'll spread it. You'll bring more people in as we continue to develop resources that are going to work for you. This month, for example, in the circle, we talked about your thyroid. We're going to tackle cardiovascular health, and we have our group coaching session next week. So it's definitely not too late to join. All right, let's see. I see one question. Hi, Beth. Let me pull this up. Hang on, it's passing me. What are the steps to figure out your liver health? Such a great question. So there's so many different things you can do. We can definitely do blood work, and there's a whole liver panel you can look at, which is beyond AST and ALT. So you can look at something called SHBG, which is your sex hormone binding globulin, a great way to understand liver health. You can also look at your hormone metabolites, so estrone, 17-hydroxyprogesterone, your androgen index, which is free testosterone and DHT. Those are additional ways to understand what the liver is doing. We can use cholesterol too, because remember, cholesterol, if it's too high and you're producing a lot of LDL cholesterol, we know again that you have a sluggish liver. So those are more the Western medicine ways of looking at it. In Eastern medicine, they have a really quick test. Stick your tongue out, and you guys can do it now if you want. I wish I had a dummy here, I'd show you, but you can stick your tongue out. If your tongue has a liverish sort of hue to it, that's liver meridian issues in Chinese medicine, then we know you're going to have an issue with breaking down toxins and overall toxicity in general. So liver meridian, and if you don't know how to do this yourself, and we'll post a picture to it on how to interpret your tongue, but an acupuncturist, a Chinese herbalist, they're very good about picking this up way before the lab work picks it up as well. So this is why I love kind of the medicine we practice at Center Spring MD, because it's a lot about combining Eastern and Western medicine together. And by doing so, we get a really good sense of what the body may be moving towards and where you are right now. The other good sign of a sluggish liver, or the fact that you are prone to a sluggish liver, are genetics. So genes like MTHFR, COMT, SOD2, these are all genetics that lend themselves to very sluggish livers that in turn are more prone to inflammation, autoimmune disease, weight gain, depression, even alcoholism, and mental health issues, and so much more. So knowing your genetics is another helpful tool as well. Okay, any others, guys? Any other questions that you guys have?
One says, I've heard that glutathione helps with detoxing liver. Is that true?
So the question's about glutathione. I don't know if you guys can hear, but the question's about glutathione and detoxing the liver. Has anyone been on glutathione before? So glutathione is one of my favorite antioxidants. It really does come in and provide a lot of oxygen to the cells. I absolutely love it. Yes, it actually does help the liver. It helps clean the liver. It helps with detoxification. We actually not to get too nerdy or chemistry detailed, but there's phase 1 and phase 2 detoxification. Glutathione can come in and help that first phase for sure and move things along. In the practice at Center Spring MD, we do glutathione IVs. And those IVs are specifically for patients that have certain genetics, or we're worried about detox issues, and we really want to regenerate the liver to reduce inflammation, to bring insulin and blood glucose levels down, and to help with general anti-aging. So yes, short answer is yes, we love glutathione.
Okay, and we have another question. How would you fix a fatty liver, not from alcohol?
Okay, fatty liver is on the rise. I think that's a part of this liver conversation. So non-alcoholic fatty liver disease is absolutely on the rise, affecting a lot of men and women in particular, usually diagnosed after about 40. It's a sign of insulin resistance. If you've got fatty liver, you have some form of insulin resistance, meaning your circulating blood glucose level is too high, your circulating insulin level is too high, and you're starting to store fat not only around the belly, but definitely around the liver as well. How do you reduce it? Well, we reduce it by bringing blood sugar and insulin down, by starting digestive enzymes that help with kind of where we started here today, really help with that concept of improving bile and bile acid secretion. Because then in turn, you emulsify fats, you break fats down, and we've seen sort of this combination of the right digestive enzymes, fiber, managing insulin resistance, exercise, and an overall anti-inflammatory diet, reducing non-alcoholic fatty liver disease. If I'm not getting where I want to go, then I will add in glutathione, maybe sometimes even glutathione IVs, and even an herb called milk thistle, which helps to sort of clean up the liver as well.
Okay, we have a question from Val. She says, lentils have been a staple in my diet for protein and fiber benefits, but now concerned that it might be adding to my estrogen dominance. Thoughts on a replacement?
So the question is about lentils and estrogen dominance. There's not a direct correlation between consuming lentils and estrogen dominance. And I'm hoping everybody knows what the concept of estrogen dominance is. Remember, estrogen dominance is when the body wants to build, store, and hold on to estrogen, can't break it down effectively, most often because the liver is not able to do its work. So lentils don't directly cause estrogen dominance. Lentils have fiber, they have protein, and they have a lot of great B vitamins. What could be happening though is that you're not getting enough dietary fiber in from other sources, or you're not soaking the lentils the night before. That helps to reduce the amount of gas or the ability to digest them, and that in turn is somehow contributing to your overall hormonal profile.
Okay, and Ron asks, what effects do cardio and resistance exercises have on the liver?
That is bringing blood sugar and insulin levels down, right? But just burning through cardio is sometimes not enough. You want to build muscle mass as well, but it definitely helps to bring insulin down. You're indirectly helping your liver. I think we have time for one more and then we're going to stop.
Sure. We can finish up with the liver question. Could liver health affect ferritin levels?
Liver health and ferritin are connected. Ferritin is an inflammatory protein. It's an iron binding protein. We never want it too low. We certainly also don't want it too high. It's a sign of inflammation when it gets too high. But yes, it's another, actually I should add that to the list of labs you can do to check your liver health. So checking a ferritin, maybe once every 6 months is a great tool as well to really assess your liver health. All right. Got most of them in?
Yeah.
All right, awesome. Well, thank you guys for joining me this Tuesday. If there is a topic or a question you want to make sure I address, we'll be live again next week. And remember, you still have time to join this month's Superwomen Circle and really benefit from all the guides, the webinars, and of course the coaching that will take place next Tuesday. All right, I'll see you guys there, hopefully. Take care. Oh, and happy Valentine's Day.